Right now, there is a condition affecting the majority of your patients. It's not caries, it's not periodontal disease, it's something most dentists walk past every single day without recognizing it, without naming it, and without knowing what to do with it. And that gap? That's exactly where the opportunity is. My name is Guilherme Cabral. I'm a restorative dentist. A few years ago, I started noticing something I couldn't explain. Patients with perfect hygiene, no caries, no obvious pathology, and yet, progressive tooth loss, wear, sensitivity, fractures, cases that didn't fit the model I was trained on, so I went deeper. And what I found changed everything about how I practice. These patients aren't isolated cases, they're everywhere, in every practice, every specialty, every demographic. What they share is a pattern, a process of accelerated oral aging driven by three forces happening at the same time: parafunctional load, surface friction, chemical erosion. Together, they break down tooth structure faster than biology ever would. I call it premature oral aging syndrome. And this isn't a rare finding. The literature already shows how common this is. This is something sitting in your chair multiple times a week. The difference is most dentists don't have the model to recognize it. They treat the restoration, they replace it, they treat it again, and the underlying problem keeps running, which means there's a massive demand and almost no supply of professionals who truly understand it. Think about what that means for your practice. A patient who's been to multiple dentists and no one could explain what's happening, and you're the one who finally does. You don't just gain a patient, you gain their full trust, their referrals, and a level of authority that no ad campaign can buy. That's how real authority is built in dentistry. Not by doing the same thing better, but by understanding something most are still missing. And right now, that window is open, but it won't stay open forever. Patients today have less caries than ever, and more wear, more sensitivity, more structural loss. The profile of dental disease is changing. The dentists who recognize this early will own this space. The ones who don't will compete for what's left. In this class, 60 minutes, I'll give you a clinical reasoning model that will immediately change how you see these patients. You'll understand how a patient with acid reflux can be silently destroying their teeth every night, and how to catch it in the very first appointment. You'll learn how to structure a diagnosis that addresses cause, not just consequence, and you'll know exactly what patterns to look for and what they mean, so you can apply it on your very next patient. This is not theory. This is the exact model I use in clinical practice every day. One recorded class, 60 minutes, 7-day money back guarantee, no questions asked. The patient with this condition already has an appointment in your schedule this week. The question isn't whether this opportunity is real. The question is whether you're going to see it before everyone else does or after. Click the button below and watch the class today. It will change how you see your next patient, because in every area of dentistry, the professionals who move first position themselves first. And right now, this space is still open.